Let's get started. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. Today, we are trying to give you a look at the broader emergency response efforts going on in the community. We will hear from Dave Donovan, Director of the Scott County Emergency Management Agency, and Colonel Stephen Marr from the Rock Island Arsenal. We will also hear from Ed Rivers, Director of the Scott County Health Department, and Nita Ludwig, Public Health Administrator in Rock Island County. All participants will take your questions at the end. As always, please type them in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Ed, will you start us off, please?
We don't have any additional cases to report at this time, but we've noticed an increase in questions about COVID-19 and businesses and place of employment. As it was reported yesterday, Governor Reynolds' declaration identified additional types of businesses that are required to be closed. These are bookstores, clothing, shoe and jewelry stores, luggage stores, cosmetic, beauty or perfume stores, florist, and furniture and home furnishing stores. But it does not affect other retail establishments such as discount stores, grocery stores, or pharmacies that might sell the same types of goods in addition to other essential food, medical supplies, and household goods. So if a business type was not listed in the declaration, it's safe to assume that business is allowed to be open. But this situation remains fluid, so this could change. Business owners are encouraged to reach out to their industry groups for clarification on whether or not their business is allowed to remain open. We've received some questions about whether we will declare this business or that business an essential service, but local public health does not have a role in determining whether a business is essential during this event. For workers, it's important to keep in mind that even though your employer may be operating as usual, you should still practice social distancing, maintaining a distance of 6 feet from others when possible, staying home if you're sick, and covering coughs and sneezes. So now we are going to Colonel Marr at the Arsenal.
Hey, good afternoon, and thanks for allowing me a couple minutes here. So at the Arsenal over the last few weeks, we have gradually and deliberately increased our health protection condition on the installation in order to protect our workforce and to limit the potential spread of COVID-19 here on the installation. Protecting our workforce, our soldiers, our civilians, and our families is our #1 priority because they enable operational readiness for the Army. Throughout this process, Rock Island Arsenal has followed the guidelines that were issued by both Army health organizations and by the Center for Disease Control. As part of this, Rock Island Arsenal commands and organizations have shifted to mission essential functions only, defined as those functions in support of COVID-19 operations and the life, health, and safety of our people and our installation. Leaders at all levels are enforcing mitigation measures to protect the force from the spread of COVID-19. Despite the ongoing COVID-19 pandemic, the Army must still remain postured to protect the nation. Therefore, our second goal is to preserve operational readiness. We have a wide variety of commands and organizations on the island who are subordinate to different Army major commands. So when the Army issues an order, each command may implement that guidance somewhat differently. The commissary, the post exchange, and health clinic all remain open and operational to support the limited presence that we have here on the island. Our retirees are able to continue to use both the clinic and the commissary at this time. Just want to highlight that that is a change from the information that we put out yesterday, where we stated that retirees could only use the pharmacy. That was incorrect. They can use both the clinic for prescriptions as well as the commissary. The Rock Island National Cemetery is closed to visitors due to installation access restrictions. However, interments at the National Cemetery are being coordinated on a case-by-case basis with physical security here at the Arsenal. So in conclusion, we at the Rock Island Arsenal acknowledge that we are part of a larger community, the Quad Cities community, and I and leaders of the other organizations on the Arsenal have been working with leaders and experts in the Quad Cities as the situation has evolved. I want to personally thank all those who are on the front lines of this fight, actively combating the spread of COVID-19 each and every day. Know that your efforts do not go unnoticed and that they are very deeply appreciated. Again, thanks for the opportunity to speak on behalf of the Arsenal.
Next, we'll be hearing from Dave Donovan from Scott County Emergency Management Agency. Dave, go ahead and unmute yourself. *6, please.
How's that? How is that?
We can hear
Is that
you.
better?
Yep, you're good.
Right. Thank you. Sorry about that. Good afternoon, everyone. Thanks for the opportunity today to share with you what EMA has been working on. I'm going to speak sort of on behalf of both of the emergency management agencies in Scott and Rock Island County for a lot of my comments. First, I want to say how appreciative we are of the partnerships with many agencies and organizations throughout the Quad Cities, from our nonprofit partners, our public health partners, government, as well as the businesses in our community. I want to start by saying that the role of EMA in this COVID event is quite different than other disasters that we've experienced in the past. We can't see this like a flood or severe weather. It's a very unique challenge. We've exercised for this type of event in the past with our public health and healthcare partners, so that has been helpful for us, but it is new and challenging for us. We have three main roles as I see it in response to COVID-19. The first is to ensure that the community effort's coordinated and to avoid duplicative effort. The second is to promote concise and effective communication between the various organizations and with the community at large. And then lastly is to secure supplies and materials that are needed for the response, and then allocate those same resources, which in this case are very scarce, because unlike a flood or severe weather, everyone needs the same resources at the same time all throughout the country. So that creates some challenges for us. Obviously, COVID-19 is centered in the public health and healthcare communities and arenas, but EMA works with those organizations in the roles that I mentioned above. Working together, both Scott and Rock Island counties are collaborating and sharing as much as we can. We're planning together. We're working together as one Quad Cities throughout as much as we can, given the differences between the two states. EMA organizes our work into various functions, such as sheltering, feeding, fire, logistics, public information recovery. And there are people from other municipalities, other nonprofit and faith organizations that take up leadership roles within those functional areas on behalf of the two EMAs. So again, we work with public health, healthcare, those functional leaders of those different functions and other partner organizations. And thus far, what we've been doing is we've opened emergency operations centers in both counties to coordinate efforts, again, across those functional areas. We've created a lot of the virtual conferencing and collaboration spaces for the meetings that we've been holding and the sharing of the information for the various functions. We helped with many other partners, not the least of which was the Quad City Chamber and the health departments and other government agencies to form the Quad City COVID-19 Coalition. And we're continuing to host and facilitate those virtual coalition meetings. We're coordinating requests for personal protective equipment or PPE from first responders and healthcare. Again, this is an ongoing effort. We expect PPE to continue to be in low supply. And that's one of our biggest challenges that we're experiencing. We're collaborating with partners to address community sheltering and feeding issues. We're coordinating amongst faith organizations in our community to leverage volunteers to assist Quad City residents in need. Promoting, again, the sharing of information amongst partner organizations and in public information opportunities such as this. And then lastly, we act as a liaison to the states of Iowa and Illinois for information sharing, resource requests, and coordination. The current work, as I see it, has been quite successful. Obviously, the challenge remains in front of us yet. We don't know where this will go. We don't know where this will end. There's a lot of challenge, but we see that the work that we've been doing and will continue to do is a fruit of labor of several decades of work. Both EMA and other community leaders have been working a long time to build these relationships and this collaboration before the event. So that allows us to leverage that synergy and work together more effectively. So, we're just happy with these relationships and very pleased and thankful for that, and so that we can work together with the Quad City community and we will overcome COVID-19. So thank you all.
Thank you, Dave. We will next hear from Paul Rumler with the Quad Cities Chamber and then Nita Ludwig with the Rock Island County Health Department. Go ahead, Paul.
All right, thank you very much. I want to start off by thanking all the health officials and the frontline health workers and everybody who's still providing those essential services in the community. Their role cannot be understated or overappreciated. They're doing some great work. From the Quad City Chamber's perspective, we are tracking and want to make sure that we're recognizing all the special financial assistance programs that have been made available to businesses of all sizes and industries, including nonprofits from the state of Illinois, state of Iowa, and as of today, the federal government. Some of these programs are grants for forgivable loans, tax credits, and we're recommending that businesses seek them as they qualify. We're hoping that businesses will take this time to assess their situation and really leverage the assistance that's been made available based on their requests. Some of these programs are loans. Some of them could be converted to forgivable loans, but before they apply, we're suggesting that businesses talk to their financial institution or a professional to make sure that they are appropriately leveraging those resources without jeopardizing existing loans. There's a lot of details that are still forthcoming, and we know that the businesses that have been impacted by this are trying to manage both maintaining their operations as well as seeking this assistance. So as these businesses have questions, we'd like to encourage them to contact us at the Quad Cities Chamber. We have a team of cross-functional experts that are ready to advise them and guide them to those resources. There's also partners at SCORE and SBDC, which are free assistance to help work through those applications. Our chamber website is quadcitieschamber.com, and we have a special COVID-19 business resource pages that we're frequently updating that include new clarifications like what came out today from the state of Illinois, which is providing more guidance on what an essential business is versus a non-essential business, because that was a very popular question over the last couple of days. So with that, I'll end my comments and be available for questions. Thanks.
Thank you, Paul. We will now hear from Nita Ludwig with the Rock Island County Health Department. Nita?
Hello, this is Nita, and we are still at 4 total cases in Rock Island County as of this afternoon. I did want to address a few things about stress and anxiety. Nothing is normal right now. So it is normal to feel sad, stressed, confused, scared, or angry during a pandemic. We hope these thoughts will help you deal with the stress and anxiety that many of us are feeling right now. Talking to people you trust can help. Try to make time to contact the people you love over the phone or through video chat. It might be tempted to turn to tobacco, alcohol, or other drugs to deal with your emotions. Those are just temporary fixes that will make the situation worse. If you feel overwhelmed, seek mental health services. Limit worry by decreasing time you watch or listen to media coverage. Maintain a healthy lifestyle, including a proper diet, sleep, and exercise. Going for a walk, run, bike ride, etc. are all okay as long as you practice social distancing. Get your facts from credible sources such as CDC or the WHO, state departments of public health, or your local county health department websites and Facebook pages. Draw on skills you have used in the past to handle stress. Maybe you've found that yoga, meditation, or music have helped in the past. I've enjoyed watching classic baseball games since there's no baseball being played right now. It is important to know that children might respond to stress in different ways, such as being more clingy, anxious, withdrawing, getting angry, or agitated. Respond to your child's reactions in a supportive way. Listen to their concerns and give them extra love and attention. Provide facts about what has happened and explain what is going on now, and give them clear, age-appropriate information about how to reduce the risk of them being infected. Make opportunities for the child to play and relax. Keep to regular routines and schedules as much as possible, or help create new ones in a new environment, including school learning, as well as time for playing and relaxing. Please try to remember that every one of us are going through a traumatic situation right now. Treating each other with kindness, empathy, and grace will go a long way. Thank you.
Thank you, Nita, and to all of our speakers today. We appreciate your time coming on the call and giving some of this information that will be valuable to our community. We will now go to the question and answer section of the press briefing. Please go ahead and type any of your questions into the chat, and we will continue reading them and providing it to the correct individual that's on the call today. We'll start with the first call. This one is for Dave with EMA. Governor Reynolds just said they are planning to get together to plan surge strategies for hospitals. Has no work been done on that to date?
Okay, Brooke. Yes, work has been done on that to date. And what Governor Reynolds was referring to was a new state initiative that was rolled out today. So the planning work that has been done, we've always planned with our healthcare partners for surge capacity. So that is the ability to handle surges of patients beyond their normal capabilities. We've done that. We've done that with our hospital systems here. We've done that with community health care and other health partners in the past. However, what Governor Reynolds was speaking to today was this idea of regional medical coordination, and that is being implemented due to the widespread nature of the COVID-19 situation and the issue that presents, in that we cannot offload patients potentially outside of our area, or at least not very easily, since this this situation exists all throughout the country. And so they are working on a system. The state is divided into regions, and there will be coordination done at each region level and then at the statewide level as well. So it's just another mechanism to help us make sure that we have health care available within the state for those that need it, and so that we can coordinate that as well.
Thank you, Dave. We have another question. This one would be for Nita with Rock Island County. How is Rock Island responding to the recent case that was confirmed in a retirement community? Since retirement communities house a vulnerable population, is the county taking any additional steps to monitor these communities?
Sure. So while I really can't speak to any specifics, I can tell you what our infectious disease nurses do. When they get a confirmed case, they do contact tracing, which is to find out where the person was, what their living arrangement was, the date of their illness, who they may have been in close contact with. And they also have been giving out a lot of education on cleaning and disinfecting, guidance for healthcare workers and for patients of any setting. So all of that has been occurring.
Thank you, Nita. We have a question here. This is probably best answered by Paul with the Chamber. The unemployment numbers yesterday, do you have any feeling for how many of those filings were in the Quad Cities? What was your reaction to seeing those numbers? And then we will have a second part to that question.
Yeah, I do not have specifics in terms of what employment filings were here in the Quad Cities. We do know that they were definitely up here in talking with those departments. We have not seen a large influx of changes at some of the primary industry employers in the area. I think a lot of the unemployment filings are from those companies that have been placed in more of the shelter in place or non-essential areas, or the restaurant and bar sections. Those were the immediate impacts. I think some of the federal assistance that was just passed today and will be in effect soon will hopefully provide some relief for those, because they provide incentives for those employers to rehire those employees that were just recently laid off and have a chance through some of the forgivable loans to be made whole in those situations for bringing them back on payroll.
And for the second part to that question, now that the federal government seems to be nearing a signed deal, what are some other things you are keeping track of that could help or stabilize the Quad Cities economy?
Yeah, I think it's very important to make sure that the business community and employers and the employees are part of the flattening of the curve effort. That will be the biggest indicator for how quickly we can get on the other side of this and start talking about how we support the businesses in their recovery. So we at the Chamber are taking every effort that we can to make sure that we're focusing resources to support the existing businesses going through this major issue in terms of their normal business cycle. We're hearing that their biggest questions are about access to the financial assistance. So we will be helping provide guidance in that area. We're also providing information like on the Families First application of the long-term and short-term time off requirements that are now available as we deal with COVID. But I think first and foremost, we need to focus on the recovery of our well-being and health, and then we can focus on the economic recovery.
Thank you, Paul. Additional question, are you planning weekend Zoom calls? I think I can speak on behalf of the group that at this point we are not anticipating any Zoom calls for the weekend. What is the turnaround time for tests to results locally? Nita, do you want to describe that for Rock Island County since you're doing some of the requests for testing?
Sure, for the Illinois Department of Public Health labs. So if hospitals or urgent cares are sending to the Department of Public Health labs, which again are in Chicago, Springfield, and Carbondale, their turnaround time is really quick. We're getting them between 1 to 2 days. If they are going through one of the commercial labs like LabCorp or Quest, they are taking somewhat longer, but we don't know the exact turnaround time on that. We are only getting results if there is a positive.
Next question, this one is for Dave. Back to the description you were providing earlier. Could you please explain what offloading would entail? How would that work?
I assume that when I was describing the regional medical coordination, I must have used the term offloading. That was probably a poor choice of words on my part. It's really, it would be patient transferring, I think is what I would better characterize that. And that is, you know, the idea that if we had a localized event and our hospitals were overcome, we could look to transfer, do interfacility transfers, or move patients to hospitals outside the area. Since healthcare systems all throughout the region, throughout the state, and throughout the nation are potentially overwhelmed, I think the approach that the governor's taken is making sure that we are, if there are empty beds elsewhere, that we're identifying those and coordinating that, and so that if we do have to make a patient transfer, we can do so. And again, the bottom line with all of this, and the goal with all of this, is to ensure that we are, wherever possible, getting the patient care when and where it's needed.
Thank you. We have one additional question. If you have any others, please type them into the chat now. This one is for Paul, but perhaps we could have Ed follow up with some of his talking points as well. What advice do you give businesses that still need to be operating? We hear anecdotal stories about workers at Deere, Arconic, Sears, and others who are scared to be at work because of the closeness of some of the work areas and people continuing to work while they are showing symptoms of a flu-like illness.
Yeah, good question. So it's clear. Let's follow the advice of the health professionals. If you feel ill, stay home. I think that's been abundantly clear. There's guidance available for those critical businesses or essential businesses that must stay open. And for their employees, they're recommending that they establish social distancing within those places of employment to make sure that they can actually mark off what 6 feet looks like. So that way they can maintain good distance as they do their business. They also need to be evaluating what can be done remotely. Even though their business could stay open, they need to be making sure that those that are mission critical to be at the site are the only ones that are on site. Anybody else that can be working remotely, they should be.
I don't have much to add to what Paul says. He covered it well. We also have advice for businesses from our Department of Public Health on our website. And just keep in mind social distancing practices, as Paul mentioned, 6 feet, staying at home when you're sick, covering coughs and sneezes.
I'm going to skip one question just because there's a follow-up question to this. What if employers are not respecting that? Do we have advice for them? Paul, do you have suggestions on that front first?
For my advice to the employers who are not following the guidance? Is that the question?
Yes, what if employers are not respecting that? Or yes, she said yes. How you interpreted that is correct.
Yeah. I can't imagine an employer who is willingly not following that guidance. It would be a shame if they weren't. So an employee should be making sure that they're going through their proper chains of command to make sure that they're voicing their concern.
Thank you. The last question might perhaps be best for Dave. Are you working with private for-profit hospitals such as Select Specialty in Davenport?
Yes, we've engaged with them. Actually, you know, the health department has engaged with all healthcare in Scott County, and we continue to stay in touch with them. Obviously, this coordination that will be taking place, we'll leverage that to a greater extent than what we have to this point. But, you know, in the presentation that was given today on regional medical coordination, it talks very much about for-profit hospitals as well as long-term care centers that may have available bed space. And I think, you know, the idea is to leverage that as much as possible and identify that and work together throughout our region, throughout our Quad City area here to make sure that we're making effective use of the bed space and appropriate use of that bed space as well. Ensure that we're saving those ICU beds and those critical care beds for you know, the folks that are most in need of them.
One last question we're able to take, and I'm not sure if we have anyone on the call here who can respond directly to this. Perhaps Dave, any word about the hospitals receiving more ventilators?
I have not heard of anything specific. I do not know if any of the hospitals have been reaching out and acquiring more ventilators on their own. They are working. So the way this works is not everything flows through the EOC in terms of resources. All healthcare, all first responders are asked to first utilize their normal channels to acquire the supplies or the durable equipment that they need. So I can't speak to that directly for the hospitals. I have not heard that there is a need that has not been able to be filled at this point.
Thank you very much to all of our partners for participating in this briefing. We would like to conclude today's briefing by introducing a new resource that's available to the community, which we'll be pulling up here for you. The Quad Cities COVID-19 Coalition, of which we have some of the partners on today's call, have developed a website. It is togetherqc.com, and it's dedicated to linking residents to resources and information related to COVID-19. The site will connect you with public health, business, government, and social service resources that are providing support during our community's COVID-19 response. The Quad Cities COVID-19 Coalition partners invite residents to browse the site and learn how each individual person, organization, and business can help to minimize the spread of COVID-19 in the Quad Cities. We appreciate your support as members of the media in communicating this resource to the community. And as always, thank you for your partnership in communicating with COVID-19 resources for the community. So thank you all for participating, and we look forward to being in communications with you in the upcoming days.